So, Bora, it's a very big privilege for your classroom to be with Dr. Sergülen Dervişoğlu today.
Yes, hocam, of course. I know that she is a very well-known pathologist, especially in this bone and soft tissue pathologies. And I want to, as a class representative, I want to thank you, our professor, for the significant attendance on behalf of my all classmates. I am pretty sure that this patho class will be a very useful and good experience for us.
It's a very big honor for me to welcome and to present Professor Dr. Sergülen Dervişoğlu today. It's a big honor and big pleasure for us to be with her. And let me have a small introduction about her academic life. She has graduated from Ankara Fen Lisesi at 1975 and from Ankara University Medical Faculty at 1981.
She is not only a very well-known professor in the academic area, also she has a side which interests in art, and I gained some information about it, and she is interested in also music and the art and paintings, and she attended some exhibitions with his products or paintings, as far as I know.
Her şey için teşekkür ediyoruz. Hiç bu kadar yoğun gündemde bizlerle beraber oldu, bize katıldı. Tekrar teşekkür ediyoruz.
Host gives some reaction to the tumor. This is an immune response, kind of a reaction. So especially some tumor cells, tumor tissues have a lot of lymphocytes in their stroma. Rhabdomyoblast, adipocytic cells, smooth muscle. Do you have any idea? They look to one of these well-known cells. We have tried to look if they look alike their tissue of origin. That is the way that we try to give the grade.
Hocam, we know this TNM classification, like the important properties of the tumor are the tumor size, lymph node metastasis, and also a possible malignancy.
It's basically fat cells with some septas in between. And here we can see veins and arteries feeding the tumor.
If the tumor is large in size, larger than 20 or so, this could be a kind of problematic. We may think of low-grade liposarcoma, morphologically atypical lipoma, so it has a high risk of recurrence.
These are as you see here, chondrocytes that produces extracellular matrix for extracellular matrix produces for cartilage.
Cortical invasion is clue for malignant invasion, that is chondrosarcoma. But I would like to see, I mean, we have to see to be sure. For the grading, you're right, it is most probably grade 2. Most commonly we see grade 2. Grade 3 is so very subtle.
18 years old male patient. He came to the clinic with pain, swelling, and a difficulty in movement on the left thigh.
In bone tumors, if they are benign, they push aside the trabecula because they grow in expansile type of growth in benign bone tumors.
What will we expect, or what do we expect from pathology in the next, like the 20 or like the 30 years that we will be in this, like, how can I say, in this occupation?
Thank you for Sergülen abla and all the students. It was a very nice pathology lab. Then it was a little bit philosophic, the end of the lab. And I think it's also important for students to think about such things.
Thank you for your attendance. I enjoyed every minute of it, really. It was really nice. Whenever I am ready, you know, if I have time, we can do it again if you want. Thank you. It was nice to see you all. And thank you for the good, very good detailed presentations of the young generation, our doctors, early doctors. And I'm happy to know them.